Vanishing in Tokyo Hospital. Women like talk, talk, talk everything. So as are the hospital nurses in Tokyo. There is a big nurse community online to exchange information about their working places. Mostly they are just chatting about handsome young doctor coming in her hospital, or salary comparing each other, or some patient so funny, or delicious foods in some restaurant, etc. But sometimes it gets serious. Medical accident happening that caused by her co-working doctors. There many cases doctors can escape but the nurse cannot. This is because she actually did the medical act, which caused the accident, but in fact, it was from her doctor, he had directed so she did. Nevertheless many doctors, to escape the responsibility, tell a lie. That was not my direction, but the nurse misunderstanding did the mistake. Alas! No way, poor nurse. All the responsibility now mounts on nurse. So she may lose everything if not compromise. In Japan it's very difficult to prove doctor's mistake, in other words very difficult to verify the nurse innocence, for the hierarchy in hospital, whereas they are less knowledgeable, having less money, knowing less law advocators. Therefore the network is needed to protect them. Then nowadays, after coronavirus spreading, their concerning is the infection. Many big hospitals in Japan have their own laboratory, where doctors can analyze the biological samples, such as blood, tissue, genetic materials, bacteria, enzymes, proteins, etc. in order to check infection. Can there be tested coronavirus? Yes, of course they can. So the all workers, including doctors, nurses, clerks, caregivers, etc., are secretly tested. And if some found positive, he or she must stop the work immediately, and be ordered self-quarantine at home. It's not officially announced, just disappear all of sudden. Then all the around there realize whom now infected. That is called vanishing in Tokyo Hospital. Communication above online something like the following. You know, today, doctor has gone in my section. Then another, oh, me too, in my hospital, 2 doctors have disappeared last week. Then the third, you too? All respiratory specialist being down now, so our hospital director calling help to his university, so and so. Yet, no one knows how many doctors or nurses have been infected, since they have just vanished. All covered of course, never to be known in public. Do you know why? Guess what will happen if any found infected in hospital? Such hospital must be closed for a while, then all workers and patients there must be tested and quarantine at least 2 weeks. Huge money, tremendous loss to the hospital. Hospital administration belong to Tokyo Municipal, they hate the number rising up, since doctors' infection indicate wildly spreading coronavirus there. That makes Tokyo Olympic difficult. Many Japanese professionals have pointed that the number of infection simply in proportion to the number of total test. That means infection itself is expanding by not tested invisible patients. Yes, that happened in China. However, because of Olympic, all those are heard only by the air around, so the wind. Only wind whispering.